family in. I'm sorry to keep you waiting. Please come in. Please sit down. It's a little unclear to me if you all have met, whether we need to introduce ourselves.
I'm Carla.
How are you?
I'm a nurse in Burns.
You're a nurse?
I'm a nurse, yeah.
At which area of the hospital?
In the burn unit.
Burn unit, okay. Carla?
And I'm Penny. I'm Carla's sister. Not Peter.
You don't have a medical career or?
No, I'm an investment banker.
Investment banker. Okay, thank you. And let me just explain quickly my role here and kind of what this meeting is about as far as I know, and you guys correct me. Your mother's been in the ICU about a week. She's intubated. But my role is to try and see if there seems to be an impasse or a conflict here about what should be done about her treatment. And my role as an ethics consultant is to try and help the parties, the medical team, and the family to try to come to some understanding as to what needs to happen over the next few days. If there's an ethical conflict here, to see if there's some way to work that out. So I don't make a decision for anybody. I'm not a decider. If anything, I recommend the process and hope everybody gets on board and try and clarify issues and make recommendations to the medical staff and to the family. Is that pretty clear what my role is?
Mm-hmm.
Okay. Let me ask you ladies, is there anybody here who should be here to help you make the decision, or are you two the ones who are deciding for your mother?
We're it, yeah.
Okay.
Yeah, our dad is not alive, so CP.
What's your understanding of your mom's medical condition?
Well, I understand that she had a stroke, and that the prognosis is looking pretty poor, actually. So I'm very concerned because, you know, I've been very close to Mom. I know you live out of town, and I know it's hard for you. I'm not going to judge you or blame you, but for me, she made it very clear that she wouldn't want this. So I'm really concerned about prolonging her life, and we don't even know if she will survive this or where she'll be when she comes to. So I'm concerned that we're prolonging the inevitable, and then even if she comes to, you know, what kind of life will she have? What kind of quality of life will she have? And I'm just afraid that she'll be mad at us and resent our decision-making when we're in an opportunity to help her.
Okay. Penny, do you have any?
Well, I'd like to hear from the doctor, actually. I mean, obviously my sister and I talk regularly, and, you know, I get updates on my mom, but since she's been in hospital, obviously I can't get updates from her, and, you know, I'm not a medical person, so I'd like some detail and an explanation of her condition, you know, over the past week, and then how she's doing today. As well as the options from the medical point of view.
Okay, Dr. Murphy, do you mind?
Well, as you probably know, the patient, well, your mom was transferred from this older institution to our institution for further care. She was unfortunately found with a 7-centimeter stroke in the right hemisphere, which is for good or for bad, it's the non-dominant hemisphere. And that will change the way that we approach this case. However, the extension of the ischemic area, the extension of the stroke is pretty significant, and she was intubated just for airway protection prior to get transferred over here. She's now with the ventilator. She's ventilator dependent so far. She's on sedative medications because of the breathing tubes to keep her comfortable. And we had one of our neurosurgeons taking a look at the case and discussing options with us, and to see if there was any benefit of I would say a decompressive craniotomy, which is a surgery to relieve the pressure that the ischemic ischemic stroke causes against the skull, but that was not the best therapy that she was going to need. So that option was not good in this case. So we decided to continue all our medical care.
Excuse me, is there any significance to the fact that it's an ischemic stroke? Any medical significance?
Yeah, what does that mean?
There are two types of a stroke, basically. The word stroke is an insult to the brain tissue, either because of the lack of blood flow, and then, of course, lack of oxygen. So that one is an ischemic stroke, which is the insult that the brain suffers when you don't have oxygen and blood to supply all the neurons. Sometimes the vessel that supplies the same area just blows up, or because of like a peak of blood pressure or another type of mechanism, and at that point you don't have a lack of blood supply, you just have a hemorrhage within the area. So that's the other type of stroke, and the management is different.
So she has the lack of oxygen one.
Yes.
But only to part of her brain.
To the right part of the right hemisphere.
Okay.
And can you tell yet what symptoms that would show, what part of her body would be affected from that?
Well, we are crosswire, so all the left part of the body is controlled by the right hemisphere. So if the right hemisphere gets affected, you wouldn't be able to move, you wouldn't be able to feel sometimes a stimulus on the left side. So probably she's going to end up with something called hemiparesis, which is a paralysis of the left side of the body because of the right side is affected.
Do we know that has happened, or is that something that just often happens? Do we know that in her case?
That's been seen in the images.
Okay.
Yeah.
What does it mean for speaking and swallowing and those other things?
So, well, the swallowing is something that the swallowing part, the swallowing process is something that we will have to evaluate either by a higher function of higher level of consciousness, and also by a lower level of blood supply at the level of the pons, which is not affected in this case. So she theoretically should be able to swallow. But if she's not conscious enough, the swallowing process could be fine, but she wouldn't be able to realize that she has to swallow. Because
so she might choke.
Yes.
And then aspirate and have pneumonia.
Correct.
And get a feeding tube.
Okay, let me clarify something for my sake. You said a few minutes ago, I believe, that you thought her prognosis was pretty poor. In my conversation with Dr. Murphy, I didn't get that same impression, so I'd like to clarify that. What is the prognosis, or what is, in your opinion, is the prognosis right now?
Well,
right now she lives alone, and she gardens, and she's able to do a lot of things completely
I
independently.
understand she was very active.
So I'm interested to know, what do you imagine? I know you're predicting, and we're asking you to do something hard, but...
Well, I have to be honest with you. And I imagine as I said, she's going to have a left-sided paralysis. So she's not going to be the active person she was before.
Can she live independently? Or she'll need to be in a home of some sort?
She wouldn't be able to ambulate at least for some months because of the left side paralysis. So she would need some sort of comprehensive rehabilitation initially. The speech area is on the left side of the brain, so that area is okay. So at some point, she will be able to communicate.
And yell at us for making this decision.
Well, maybe not, but at least she'd be here to yellow. I mean, otherwise that's it.
I know, but how do we afford to have someone in the house? I mean, I can't do it. You work, I work, we have family.
The money's not the issue. I can pay for that, that's the least I can do. I know you're here with her all the time, and, the burden of running around and going to appointments, if she can live on her own. But, I think we should give her the chance.
I don't think she would want this. I think she'd be really unhappy. I don't know. How do you decide?
Yeah, that's a good question, and that's something that we need to talk about. In fact, I'm glad you asked that. How you guys decided is something I can provide suggestions for. For people who have to decide for their loved ones, the first standard that we look for ethically is what would you decide if you were in her shoes? What are her values? So if you would tell me, Penny, about her life before her stroke.
Well, she's very fiercely independent. I think the other thing that my sister's not talking about, which is kind of the elephant in the room, is that my aunt had a stroke, and our mom looked after my aunt for a very long time, and she did say, I wouldn't want to end up like that. Now, my aunt was almost totally dependent. It's different than what you're saying, where, she might have some paralysis, but she might still be able to talk, she might still be able to get around to some extent, depending on the rehab. So, I understand where Patty's coming from, but I guess I'm thinking, we know what my mom would choose when she was totally healthy and living independently. Of course, we all say we don't want to end up like that, but, I think she viewed it more as a black and a white. If you have a stroke, you end up like my aunt, which is totally dependent, needing somebody to change your diapers, versus needing some level of support, but still being able to interact with people and talk and understand what's going on. And to me, there's a big difference. So I'm just a little more hesitant to say, let's pull the plug now and let her go, given we still don't really know, what her recovery would look like. We can project, but she is very independent. She might yell at us, but I'd rather she yelled at us than, you say pull the plug and then there we go. That's it.
It's such a gray area. It's so hard, and this is speculation. Medicine.
Yeah, I know.
Let me back up just a little bit. Does your mom feel connected to a particular religion, faith?
Yeah, she's Catholic.
Catholic?
Yeah.
Okay. Has she been able to be a part of a particular parish in the last year or two? Okay.
Yeah.
Yeah, she was very connected to the parish, and they helped with my aunt too, and people in the church were supportive.
And what kind of activities did she participate in typically?
She volunteered in the community. She was involved with the church. She would read at the library. She would garden in the yard. She was very active, kept busy.
Hobbies?
Drove. Yeah, she drove. Book club, she liked to read. What else? The gardening was probably her favorite activity.
Yeah.
She spent a lot of time in her garden? So it gave her a lot of pleasure? Okay. Other than that experience with the aunt, were there any other experiences where end-of-life topics would have come up that you can remember?
We didn't really talk about it.
Okay.
We really just didn't. I don't know. I think with our aunt being so ill, she just was put in that position. She had to do it, and she did it because she loved her sister. And then she did. She kind of just said, I would never want to be like this. Yeah. And I just think I'm afraid that if we do this to her, she's going to resent our decision-making, and that's my concern, is she'll never forgive us. And that's something that would be really hard to live with.
Okay. Let me just remind you that I understand your feelings and fear, and you don't want your mom mad at you. Nobody does.
Yeah.
But the question really is, what would she decide? If she was sitting where you are, deciding for herself, if she was able to sit up in bed and talk, what do you think she would decide? And let me try and clarify something that may help out here. A couple things. Did she have advanced directives?
No.
Okay. I want to verify that because we weren't aware of any. But sometimes
nothing.
they're at home and
No.
family hadn't brought them.
Just
in.
that, throwaway comments about my aunt
Okay.
really is the extent of it. And obviously when my dad died, but, other than that, we didn't, she was focused on life. She wasn't thinking, of course, that anything like this would happen to her.
Sure.
It's improper to talk about death, we just didn't talk about it.
Yeah.
Just really didn't.
I have a really vague question, but I think it's important. What do you think gave her life meaning or purpose?
I feel like it was her independence. I think she really enjoyed, taking life by,
Okay.
by the horns. I really think that was her passion.
Okay. So let me clarify something medically, Dr. Murphy. Do you think it would be medically appropriate to withdraw life-sustaining treatment or life support at this time?
Not right now.
Okay.
Not at this point.
How much time?
I will give her at least three days more.
3 days more.
Yeah, I would like to see, because I believe there might be some improvement on her condition.
How can we know in 3 days? What would be like?
The stroke is serious and it's a severe one, but it's not in the dominant hemisphere. So I believe if she comes off the ventilator, which is our next step, she may be able to communicate.
And then she can tell us.
So
Yeah,
I
I think
wouldn't,
she can tell us what.
But then it'll be too late. I mean, she can't say, damn you for doing this, I'd rather die. I mean, then what?
The problem is she's not actively dying now. She's stable.
Okay.
She's stable.
She's not on pressors or anything?
No.
Okay.
No, she's
So it's
not.
just the ventilator and what else?
The ventilator was, the mechanical ventilation, that the breathing support was initiated just because the patient was going to be transferred.
Right. Not because her
we
lungs
need it.
weren't working.
Was she communicating before the ventilator?
I don't think so, because her mentation was affected, of course, because of the stroke.
So if we turned off the sedation, what do you suppose we could gain? Could we communicate with her then and see if she could signal or write something? Or
We could, we will turn off all the sedative medications, and we will see we will try to evaluate if she's able to follow commands.
Okay.
If she understands this.
What if she doesn't?
Well,
Couldn't we revisit this issue then, whether you withdraw life support?
yeah,
I mean,
theoretically, because of where the lesion is, she should be able to understand this. So that's my hope.
And you're talking about doing that today or doing that in 3 days, waiting 3 days?
Sometimes the patients are not waking up because there are too much inflammation in the brain and there are circulating substances. So the level of consciousness is still impaired. Sometimes the sedation needs to wear off completely, and sometimes it takes us more than 1 day. So that's why we try to obtain these parameters on a daily basis to see if the patient is able to come off or not. If after 3 or 4 attempts, and that would mean 3 or 4 days, if she's not able to, at that point I will have to talk to you again, and I will tell you the truth. I will tell you she's not doing anything for us. She's ventilator dependent at this point completely. She's not able to breathe on her own, even when she's off the medications. So we need to discuss.
So why can't we do that? Why can't we agree on that?
Let me add something too that might be helpful. What I'm hearing is both of you feel like you don't have enough information about what she would choose for herself. You do have that one statement that was very strong, but there is concern that she didn't envision this situation exactly.
Well, she did kind of, but it's
not
different.
enough information.
It's different kind of stroke than Auntie had.
Right.
Okay, so if you ethically, if decision makers don't have enough information to decide as if they were her, then the question becomes what's in her best interest. And it sounds like you're saying, and correct me, Dr. Murphy, if I'm wrong, it will be a little easier, you'll have more information to decide what's in her best interest in 3 or 4 days. Is that correct?
Absolutely.
Okay. Does that make sense?
I think I understand. So we would maybe revisit this conversation in 3 or 4 days,
Exactly.
based on what you can gain medically
Yeah.
in her response.
Medically, clinically, she's stable at this point.
Okay.
So she's not, as I said, she's not dying right now.
So to remove her tube, she could die. She may not breathe on her own.
Yes.
Okay.
That's what happens.
Okay.
And that would give you 3 or 4 days to think about what would be in her best interest. Talk to anybody that you rely on for counsel. My sense is everybody around this table wants what's best for her. And you certainly want her to be as independent as possible and have no regrets. You don't want any regrets. You don't want her getting upset with you. I understand that. You also share the same things, my understanding. You don't want to act prematurely.
Yeah, I don't want to kill her.
Yeah.
But just because we can do something doesn't mean we should. And I think that that's the line that we have to really be aware of.
Yeah.
You know? That's just my feeling from Mom is, you know, not every medical intervention is the best for everybody.
Have you seen that from your own experience in your unit?
Yeah, I really have.
Yeah.
But I just don't think, I mean, I know you've been involved and you're a nurse and, sometimes you think you're a doctor, but, I think that, we have to listen to the kind of medical folks who are taking care of her, and they're saying we can't tell yet. We don't know which way she's going to go. She could get better. She might be able to come up the vent. And, I agree, Mom doesn't want to be in a nursing home, in a wheelchair, and all of that. I feel like if we stop everything now, we're killing her. I can't live with that.
So do we have a consensus that in let's say 4 days, in case the sedation wears off more slowly, we'll meet again 9 o'clock here, and we have your phone numbers, I believe, in the chart in case.
Now, can I be her power of attorney? Can I make all the decisions since we're closer? I can't.
You can't just say I'm the power of attorney.
Well, I'm just asking because I feel like I know her better. I just want to make sure.
No. If she had filled out a medical power of attorney before she had the stroke, she could have appointed anybody, both of you, a friend, her priest, anybody.
Okay.
But since that didn't happen, it needs to be a joint decision.
Because you're
And it
here
needs to
more
be shared
doesn't
with
mean
your
she's closer to you. You don't know what to talk about.
shared with your attorney. Not your physician.
We're closer.
So we agree we'll meet in
My
4
sister
days.
always thought she was the favorite.
True, Roger.
So we have an agreement at meeting again in 4 days.
I think it's fair. I think it's reasonable. I'm not happy, but I think it's probably the best.
I understand your concern that you want to make her suffer, but you also, I'm sure you don't want to see her dying.
Of course not. Of course not.
And you don't want to feel bad after it. So I think it's appropriate at this point to give her the chance. And if she does not if she doesn't make any improvement at that point, we will let it go.
Okay.
Okay.
Thank you all.
Okay. Thank you.